Welcome, welcome to another episode of Road to Recovery with your host, Recovery Lord. Now, today is a very special day because before I start today's group, I would like to give a shout out to my sister Kim, my big sister Kim in heaven. Today is her birthday, and today is also my youngest son Malachi's birthday. They share the same birthday. And a couple of years ago, because she's no longer here with us, I used to cry every year on her birthday. And, I realized a while ago that I wasn't allowing Malachi to enjoy his birthday. So I had to start, bottling that up or expressing that to myself and then getting myself together and then being able to enjoy whatever festivities that the day presented. But now I am, still a little down, but at the same time, I'm grateful for time because time has made me a little bit more at ease and a little bit stronger on this day. I wouldn't be able to do one of these groups a couple of years ago. That's how, But what do I want to talk about today? So today I would like to talk about co-occurring disorders. Co-occurring disorders. And when you look at this little graph that I have here, you see substance abuse is one circle. You see mental health issues is another one. And in the middle, in that vesica piscis is the point where two circles meet. You see it on a MasterCard. That's where co-occurring disorders exist in that circle. So, let's go right into it. So I want to, how serious are co-occurring disorders? Clients with co-occurring disorders require more complex and expensive care. So that's the first point. Clients with co-occurring disorders. And remember, a co-occurring disorder is when you have a mood disorder or a mental health issue along with a substance abuse issue together. It says they require more complex and expensive care. And because they shutting some of these programs down, because they scaling back, this means more and more people with co-occurring disorders, unfortunately, are going to be slipping through the cracks because it's harder to treat these people. So the next, clients with co-occurring disorders tend to have more problems of all kinds: medical, legal, social, interpersonal, homelessness, etc., etc. And remember, interpersonal is how you deal with other people, how you interact with your family, with your children, with your neighbor. That's interpersonal. Intrapersonal is how you think, how you interact with yourself, how you view yourself. So when you having all these problems, it could be hard trying to figure all of them out all at one time. So what I advise and suggest to people is trying to figure one thing out, putting all of your effort into one thing. And hopefully once you get a hold of that, then you can move to the next. Because if you got 7 problems and you figure one out, what's better than having 7 problems? Only having 6. What's better than having 6? Only having 5. But sometimes trying to do all of these all at one time can be overwhelming and get to a point where a person gives up. And I'd rather see you trying to work on one problem than giving up and not trying to work on anything. And contacts with agencies and providers, mental health, drug and alcohol, law enforcement courts, emergency rooms, social welfare, shelters, etc. So that's trying to get all this help for all these different issues and aspects in a person's life when they have a co-occurring disorder and it's not being addressed. It's only going to intensify and get worse. Clients with co-occurring disorders tend to fall through the cracks of the traditional treatment system and develop even worse and more expensive problems. So sometimes clients with co-occurring disorders are trending in one direction, and that's not never fully getting better. And that's only, staying the same, status quo, or potentially even getting a little bit worse. So warning signs of a co-occurring disorder. The first warning sign is a history of trauma or abuse. Having a history of trauma or abuse is a red flag that a person may have one even if it's not been diagnosed. Treated for psychiatric disorder in the past. So a previous documented either you've been EP'd or you've been at a psychiatric facility, or you was under observation, or you sat down and spoke with someone and you actually have a diagnosis, and you're not just allowing people in your family who did Psych 101. They did one psychology course and now they giving you all these diagnoses. Hopefully this is a diagnosis that you got from someone who you sat down with, who really works at a facility and has the credentials to render this diagnosis. Social struggles because of drugs or alcohol. You're clean, but it's very difficult for you to stay focused. Or you've had feelings of hopelessness or sadness for longer than 2 weeks at a time, even when you're not using. So some people like to say they manic depressed, and they only down for 1 day or 2 days, and then the next day they bounce back. They back to being themselves. They brush their teeth. They doing their hair again. They back on track. So this is saying that when you're talking about chronic depression and sadness and things like that, it's when a person has these symptoms for more than 2 weeks. That's a sign. So just being up and down like this in 1 day, that's not a sign of it could be, something else with those type of features, but it's not necessarily in the realm of, chronic depression. Common mental illnesses. So again, we talking about co-occurring disorders, and that's when you have a mood disorder or mental health issue on top of a substance use disorder. So the most common include anxiety disorders, generalized anxiety disorder, a panic disorder, post-traumatic stress disorder, obsessive compulsive OCD disorder, mood disorders, personality. When they talk about personality, they're saying borderline personality disorder. And borderline personality disorder is a mental health condition that's characterized by intense, unstable emotions and turbulent relationships. And when they talk about relationships, it's not just who you're in a relationship with. They're talking about relationships with your parents, brothers and sisters, relationships with the people in your life. narcissistic personality disorder. And narcissistic personality disorder is a mental health condition characterized by an inflated sense of self-importance and a profound lack of empathy. Now, we do know the difference between empathy and sympathy. So sympathy is when you feel sorry for somebody. Empathy is when you realize that if you were dealing with some of the same stuff they were dealing with, then maybe you could be it. You could see yourself in those shoes if you had to deal with life on the same terms someone else may be dealing with them on. Histrionic personality disorder. So someone who has a histrionic personality disorder, that's a mental health condition characterized by persistent, excessive emotionality and an overwhelming desire to be noticed, constant attention seeking, being sexually promiscuous and provocative. That's considered histrionic. Antisocial personality disorder. That's characterized by chronic pervasive, meaning you are avoiding patterns. You have patterns of disregard for the violation of rights, safety, and feelings of others. So a person that has antisocial personality disorder doesn't care about your feelings, doesn't care about your property. They exhibit recklessness and a lack of a conscious irresponsibility. They avoid responsibility. All of these are aspects of an antisocial personality disorder. And again, before we go trying to diagnose people, you have to see a professional. Don't let somebody who did Psych 101 and probably got a C, barely passed it, and now want to triage and diagnose everybody. But if you do, I would say this. If you do feel like some of these signs and symptoms, you can see it doesn't hurt to get a screening, a mental health screening by a professional. Why? Because when a person has these mental illnesses or mood disorders and a substance use disorder, how do we treat a co-occurring disorder? Does anyone know? So when you have a co-occurring disorder, meaning somebody has both of those issues, do you treat their mental illness first or do you treat their substance abuse? You're right. I do know the answer. The answer is you have to treat both simultaneously at the same time. If you are only treating the substance use disorder and not addressing the mental health issues, that person is not going to get better. And if you only addressing the substance use and not looking at any of these personality or mood disorders, then that person still will not get better. Eating disorders like anorexia, bulimia, and binge eating. Learning disorders like attention deficit hyperactivity disorder, or also known as ADHD, dyslexia, or autism spectrum disorders. So having a learning disability and a substance use disorder simultaneously. If a person just has ADHD and they smoking weed every damn day, in the realm of recovery, that person will be looked at as having a co-occurring disorder. And in having that, both conditions have to be addressed together as sequential for effective. That's the most appropriate approach to dealing with that and addressing that. The next question I have is, what is the difference between pleasure seeking and happiness? Is there a difference? What is the difference between pleasure seeking and happiness? So pleasure seeking behavior and addiction, according to the National Library of Medicine, there is a tie between pleasure seeking behavior and addiction. Most people seek pleasure to avoid pain. That's human nature. It is the way that people are naturally wired. In most people, the pleasure comes from things that are natural, but some find it in chemicals. Some of these chemicals are extremely dangerous and addictive when used. So some people find it in chemicals and in a pill because we live in an era now where everything is offered in a pill. When you're watching whatever you're watching, and I used to love watching YouTube because it didn't have all the commercials. And now every 5 seconds, it's a commercial that's advertising this and advertising that, medication and pill for your green toenails, for because you tired while you're going on a walk with your grandson, a pill so that you can ride a bike better. I mean, a pill so you can swim better, so you can eat broccoli now. And because all this is being advertised, people get in the mindset, well, hey, if I'm feeling bad, it's a pill for that. You know, when I want to get better and I'm not getting enough sleep, it's pills for all of this stuff, and not just trying the natural way of things first and foremost, and then using medication or whatever as needed or to help assist natural occurring things. What is pleasure-seeking behavior? Pleasure-seeking behavior is when a person does things to bring them pleasure. With addiction, they start by wanting the pleasure that drugs provide. Since it's a quick rush of pleasure, it's easy to see why people may try to opt for that. Most people who wind up in this situation quickly become psychologically addicted to the drug rather than a physical addiction. The physical addiction comes later, after the pleasure seeker uses the drugs more often. So it first starts off as a psychological bond. I'm going to do this and I'm going to feel better. You know it's psychological because some people feel better once the pill touches their hand. Once they actually get the pre-roll. Once they actually get a bag of weed. They didn't even roll it up yet, let alone smoked it. But just getting it and touching it, they feel a little bit more at ease. That's a sign that this is psychological. Plus, the point that I make in group is you also know it's psychological because you can't even enjoy the pill you just got without trying to figure out where the next one is coming from. You can't even spark the pre-roll you just picked up and enjoy that one without a part of your mind trying to figure out where the hell the next one gonna come from. That's being in a sunken place. Okay, so what is the difference between pleasure seeking and happiness? Okay, here we go. Someone who is pleasure seeking is generally unhappy and looking for a quick, easy way to feel good. The difference between pleasure seeking and happiness is that pleasure seeking behavior is often a short-term pleasure. True happiness is a long-term feeling that many people strive for all their life. Unfortunately, true happiness takes hard work, and some people to choose to take an easy route to pleasure. But see, when you take easy routes and you're taking shortcuts, it's gonna show itself. We know the nurses in the emergency room who took shortcuts to be a nurse because they can't never find a vein. it's taking them 2 and 3 times and shots and somebody arm all damn bruised up and swollen by the time they do find it. We know the teachers who took shortcuts into becoming a teacher because they lesson plans lack. When you see all the stuff that goes into being a teacher, that separates people who really want it and that really means something to them and somebody who just doing it for a paycheck, because it takes a lot of effort on their part. And instead of people criticizing the teacher, they'll just say that the student is not paying attention, won't sit still. But I'm sure some of these teachers are so goddamn boring that I'm sure it's pretty hard for somebody to even be engaged in what it is that they're given, because it's liability or bare minimum when they may need full coverage. Why is pleasure-seeking behavior important to addiction? Pleasure-seeking behavior is important to addiction because it seems in some studies to create a situation where a person is easily addicted to a drug. Since seeking pleasure is a natural drive, it is easy to understand why some people who are unhappy would turn to something that gives euphoria or pleasure quickly. Usually, when someone becomes addicted to a drug, they use it once and feel the pleasure associated with it. Then they do it again because the body is hardwired to seek pleasure and avoid pain. After a few times, the body begins to respond to the drug on a psychological level. The initial reaction is a psychological addiction or an addiction to the drive for pleasure. As the drug forms physical pathways to accommodate the drug, it destroys the ones that feel natural pleasure. This is where the physical side of addiction comes in. After the pathways are formed, in order to feel pleasure, the body needs the drug. It goes into withdrawal without it. This is how pleasure-seeking behavior and drug addiction fit together. The pleasure-seeking behavior causes a person to try the drug in the first place, and then the drug does the rest. So it's always business before pleasure. And if you're waking up out your bed and you think that you're going to find pleasure and only pleasure and no stress and no discomfort in no day that you live, then honestly, you have to understand that that is a clear sign that your addiction is trying to do the thinking for you. Because that's the only way that something like that would make sense. And what that addiction is trying to do is trying to save you from your feelings. It's trying to put some sunshine in your life. And when that pill can do all that, and when that bottle can do all that, that's when it got a cape on it. And it's coming down to save you. It's not the reason that you looking old as shit. Them pills not the reason why you in your 30s looking 50. They not the reason that you are looking worn and tore down. They the reason that you get a little bit of happiness out of a day. So you're not seeing something for what it really is. And that's living in a dream. And on a high end, also known as denial. But that's when you're a contradiction and you're telling people how to live a life better than the one that you are living. And who wants to be in that predicament? I would say that's a lonely place to be in. But today is Memorial Day. And for those who don't know, Memorial Day is when you acknowledge fallen soldiers who fought in battles, or you memorialize them. And what better day to memorialize, our loved ones, people that mean something to us that are no longer here. Let me look directly in this in this camera, in this phone, and tell you, you cannot get high in their memory. There is not a beer or a liquor that they sell that's going to numb that. You can't get drunk in their memory. You can't get high in their memory. You have to live. And not only that, hopefully you can live in a way that honors their memory, even though they are not here. And if you haven't been doing that, don't beat yourself up for not doing it. Start practicing it today, right now. Practice it today. And with that, let's hold our hands together and let's say, God, grant me the serenity to accept the things I cannot change. The courage. Wow, I got to say that again. Please allow me the courage to accept the things I cannot change. The courage to change the things that I can. And the wisdom to know the difference. Keep coming back. More will be revealed for you, by you, and because of you. We pray for the addict who picked up for the first time today. We pray for the addict who put down for the last time today. And everyone in between. God bless you. And if you haven't already, please like, please comment, please subscribe, and most importantly, please share this with somebody that you may think that can benefit from hearing this message today. God bless you all.